Let's talk about the steps dialysis patients can take to get a kidney transplant. Why should a dialysis patient get a transplant? Good question. Research shows that patients who get a kidney transplant tend to live longer and enjoy life much more than they did on dialysis. While not all patients are able to get a transplant, many are excellent candidates. As someone who spends time with people receiving dialysis, you can support them along their journey to a healthier and happier life, and motivate them to consider transplant. After the patient is educated about transplant, they can be referred to a transplant center. They can be referred by anyone, themselves, their doctor, or a dialysis staff. Any patient can be referred for a transplant evaluation, regardless of things like age, weight, finances, or health status. When a patient is referred, a transplant center receives just their name and basic information. Then, they'll invite the patient to attend an orientation. Here they'll meet the transplant team and learn even more about their journey to transplant. The team will give an overview and answer any questions the patient may have. Next, the patient will be evaluated to determine if they're a good candidate. The transplant team will assess the patient's physical health, mental health, social support system, and financial means. They can even help with financial assistance. It may take a few months to complete the evaluation. If the patient is considered a good candidate for transplant, they'll be placed on the wait list. A kidney offer can come any day, but the average wait time is 3 to 5 years. There are a few ways patients can get a transplant sooner. All patients should look for a living donor. This is the fastest way to get transplanted. Patients can also waitlist at more than one transplant center. This increases their chances of being matched with a potential donor kidney. Another way is for the patient to consent to receiving a high-KDPI or increased risk kidney, which come from older donors or people with other health conditions. Patients should talk to their healthcare team about all transplant options. Once your patient is active on the waitlist, congratulate them. You can continue to show your support by reminding them to attend doctor's appointments, check in with the transplant center, stay as healthy as possible, and keep up with their dialysis treatment. Help them focus on what their life can be like after transplant. Remember, your voice matters. You can help guide patients towards transplant and a healthier and happier life.